So thank you for attending the Humana presentation. So the things that we will discuss in this presentation today are Medicare and the differences between original Medicare and Medicare Advantage plans, your group plan offered through the Pension Board United Church of Christ, and a reminder of all the extra benefits, value-added items, and resources included on this plan for you. So first off, let's look at what Medicare is, how it works, and how it is different than Medicare Advantage plans. So what are the differences between Medicare and your Medicare Advantage plan? Some people may choose to have original Medicare and then choose to find a separate prescription drug plan and then a separate Medicare supplement plan to get additional coverage. So this results in 3 different cards to carry and show to providers. The Medicare Advantage plan you are currently enrolled in through Humana is the scenario on the right-hand side of the screen. With your Medicare Advantage plan with prescription drug coverage, you will have all that coverage in one plan insured by Humana. You will only need to show one Humana ID card when visiting your providers and pharmacy. You will have one place to call if you should have questions, and your provider will only need to submit claims to one place, and that's Humana. You must remain enrolled in Medicare's Parts A and B to be enrolled into the Medicare Advantage plan. So this means you will need to continue to pay your Part B premiums to Medicare, and you will not need to sign up for a separate Part D plan. Now we will take a look at the plan offered to you through Humana. Keep in mind this plan has been designed specifically for you and is different from other Humana plans that may be offered in your community. So your Humana plan is a PPO plan, or Preferred Provider Organization plan. This means that your plan has both in and out of network benefits. So let me explain what that means. In network simply means the provider has a signed contract with Humana and is in our network. Out of network means that the provider does not have the signed contract, although they may accept Medicare and are willing to bill Humana. With your plan, you can see both in and out of network providers with no additional cost share. Some things that are covered under the PPO plan are certain preventive services with no copayment, such as an annual wellness exam, a screening mammogram, and a flu shot. The plan also includes worldwide emergency coverage. This is emergency coverage when traveling outside of the United States, something not included with original Medicare. So with your PPO plan, you will pay the same amount whether you go in or out of network for care. Your plan has a $242 deductible. This is a set amount that you pay up front for certain services. Once you have met the deductible, your plan benefits will kick in. Your plan has a 4% coinsurance for most benefits. When you have a coinsurance, this means that the benefits has a percentage cost share. So for example, Humana will pay 96% of the cost and you will pay 4% after the deductible is met. Maximum out-of-pocket is the most you will spend before your plan pays 100% of the cost for covered services. So you know you will never spend more than that $2,000 out-of-pocket in a calendar year. This plan will cover all this plan will cover all medications covered by Medicare from generic to specialty. You also have the option to ship 90-day supplies of your medication right to your door. It will save money by doing so. And I will explain this on the next slide. On this slide, you can see the prescription drug benefits available to you. So Tier 1 is your generic or brand name drugs at the lowest cost share. Tier 2 are preferred brand name and certain generic drugs. Tier 3 is non-preferred generic and brand name drugs. And Tier 4 are specialty medications. And this includes some injectable and other higher cost drugs. You can use your local retail pharmacy for 30 or 90-day supplies. However, there is a cost savings if you fill a 90-day versus 30-day prescription at Humana's mail order pharmacy. You also pay the same copay throughout the stages of drug coverage until you reach the catastrophic limit of $7,050, which many rarely hit. You've probably heard of the coverage gap, commonly known as the donut hole, and the tier copays you see on this slide will stay the same even when you enter the space. As I mentioned on the previous slide, there's cost savings to you if you order a 90-day supply through mail order. Humana Pharmacy is Humana's mail delivery pharmacy that can ship your medications right to your front door. With Humana Pharmacy, 2 pharmacists check every order that goes out to ensure they are safe and accurate before being shipped to you. And additionally, Humana Pharmacy reminds you when your prescriptions need to be refilled. They can call you, email you, or text you, whichever you prefer. And you can sign up for Humana Pharmacy via the website or telephone number listed. When calling, the Humana Pharmacy team will go through your medications with you and send a fax to your prescribing physicians. If you sign up online, you will enter all your prescription information through our website. And again, a fax will be sent to your prescribing physicians. We do ask you to inform your physician's offices that they will be receiving a fax. So while you're not required to have a primary care provider or PCP with your PPO plan, Humana does encourage it. Your relationship with your PCP is an important step in managing your health. Your PCP will know everything about your health, and having one that you are happy with can play an important role in getting you healthy and active. Also, referrals will not be required whether or not you have a PCP. So Find a Doctor is Humana's online directory of in-network physicians, and this is found at humana.com/find a doctor. You can search by name, specialty, or location. Only in-network physicians will show on the site. However, remember with your plan, you can see any provider that accepts Medicare and will bill Humana. You can also search for in-network local retail pharmacies in your area. You will simply select the pharmacy tab found on the Find a Doctor page. Search by using your location, and you can filter your results by things like a 24-hour or drive-through pharmacy. So you may have heard of virtual visits or telemedicine by now. Virtual visits or telemedicine provides care when you need it by connecting you with a provider from the comfort and convenience of your home. You can receive care for minor illnesses like a cold, sinus infections, allergies, and other non-emergency medical conditions. With virtual visits, there are 2 ways to talk to a doctor, either online from your laptop or desktop or over the telephone. And virtual visits don't replace your primary care provider, but they can be used for non-emergency issues instead of going to an urgent care center. It is available to you during or after normal business hours, nights, weekends, and holidays, and if you're traveling and are in need of medical care. So SilverSneakers is a total health and physical activity program that helps you get fit the way you want, or providing access to fitness locations nationwide at no additional cost. Humana is an industry leader with its dedication to member health and wellness, and the SilverSneakers program is directly geared towards helping members meet their fitness goals. With SilverSneakers, you can work out indoors with a free basic fitness membership and have access to SilverSneakers group exercise classes at participating gyms. You can use in-network gyms close to home and even when you're traveling. You are not tied to one gym and would simply show your Humana ID card at participating gyms to utilize those SilverSneaker classes and or gym equipment. If you cannot get to a gym or if you prefer to work out at home, SilverSneakers also has a variety of online resources. You can take live SilverSneaker classes or attend workshops online. So to find out more about SilverSneakers, you can go to SilverSneakers.com or contact the number that's listed on the slide. Did you know that Humana rewards you for things like completing preventive screenings or working out? So through Humana's Go365 program, there are a variety of ways to earn reward dollars towards various gift cards. So how does the program work? Well, it's quite simple. You can complete eligible healthy activities and then earn reward dollars. These dollars can be redeemed for various gift cards. In the next couple of slides, we will review the many ways that you can earn these dollars and how to redeem your gift cards. So one way to earn reward dollars is by completing certain preventive services. Things like your annual wellness exam, screening mammograms, and even getting a flu shot can earn you dollars. This slide shows the different reward amounts and activity limits. These activities are tracked to your claims, so you do not need to report these things to Humana. You will automatically be rewarded once the claim is received and processed. Another way to earn reward dollars is through exercise and fitness activities. So by logging 8 to 15 workouts in a month, you can earn $5 for that month. You can earn even more by logging 16 or more workouts in a month. That is a total of $120 a year. A workout can be completed by taking a SilverSneakers class, walking 500 steps in a day, or a gym workout. SilverSneaker classes are automatically tracked, or you can connect an activity tracker to log your steps or workouts. You can also earn reward dollars by participating in social and educational activities. So things like video chatting with friends or family, attending a health education class, or volunteering can earn $5 in your Go365 account. A paper activity tracker is available to be printed and mailed back to Humana, or you can simply complete the form online at Go365.com. So who's eligible and how do I redeem my gift cards? Well, all Humana members are automatically enrolled into Go365, so you do not need to sign up. Now you can redeem your gift cards in two ways, either by creating a Go365 account online or by phone. With an online account, not only can you redeem your gift cards online, you can also track your rewards, report fitness or social activities, and check your balance. These things can also be done by phone by calling our Go365 team. Please note that all reward dollars must be redeemed for gift cards by December 31st, as they will not roll over into the next year. So I highly encourage those who currently have Go365 points in their account to go out there, review the gift cards available, and make sure you redeem them before the end of the year. So My Directives is an advanced care planning tool available at no additional cost. And you can use this tool to set up things like emergency medical care plans, DNR requests, and living wills. You can then share these things with your doctor and your family members. And food shopping should not have to be the top of your priority list after being discharged from the hospital or skilled nursing facility. So through Humana's Well Dine program, you will be eligible for 28 free, nutritious, frozen, pre-cooked meals. These are all different types of meal plans, and the meals are delivered right to your front door after you are discharged. So have you ever come home after being inpatient in the hospital and thought, what now? Maybe you're confused about what the doctor wants you to do next, or the new medications that you were given. Maybe you're unsure about how you get to your follow-up appointments. So Humana is here to help through our care management program. Beginning in 2022, after an inpatient hospital stay, you'll receive a call from one of our Humana's care managers. Our care managers are nurses and social workers who want to help you recover safely and remain independent at home. They can help answer any questions you might have, ensure that you understand your doctor's post-discharge instructions, and make a plan to meet your needs. Humana also offers post-discharge transportation and personal health home care. After you are discharged from a skilled nursing facility or from an inpatient hospital stay, you will be eligible for 12 one-way trips to plan approved locations. You can also receive assistance with things like bathing, dressing, and preparing meals from a qualified aide. So to find out more about these benefits that will be available to you in 2022, you can contact the number listed on this slide. So Humana offers other health resources such as case management and disease management, and these programs help members with chronic conditions such as diabetes and cancer. Humana's transplant management team can help through the transplant process from start to finish. We also offer additional health planning and support nurses for certain conditions and health-related needs. So in the next couple of slides, we will discuss the value-added items and discounts available to you. So brought to you by Tivity Health is Nutrisystem. It's a personalized weight management program on which you can receive a 50% discount on a 28-day program. You also have access to discounts for routine hearing care. A discount is available to members for hearing aids at any True Hearing center. Members must schedule appointments with True Hearing before seeing a clinician. Your plan also has coverage for routine hearing care, not found on original Medicare. So you have 100% coverage for a routine hearing exam and fitting of hearing aids, as well as $3,000 for 2 hearing aids every 3 years. And there are discounts for complementary and alternative care such as chiropractic, acupuncture, and massages received from a Tivity Health provider. Again, no claims will need to be submitted to Humana. The provider will simply apply the discount when you receive those services. Philips Lifeline is another organization that has partnered with Humana to offer discounts for their alert response services. We know how important it is for you to remain independent in your home, and the Philips Lifeline can help keep you safe and secure. So when medical and or prescription drug claims processed through your plan, you will receive detailed information regarding those claims in a monthly statement that we call a SmartSummary. This will only be mailed the months that you have a claim processed through your plan. The SmartSummary will provide details such as when the claim was submitted, by whom, the total billed amount, and your member responsibility, if any. You can use this statement to compare with bills you may have received from your providers. The SmartSummary will also help you keep track of your prescription drug spending. You can see what stage of drug plan's in and how much you and Humana have paid towards those medications. A great way to view your SmartSummaries and other plan information online is through MyHumana. So this is an account tailored specifically to you. To set up your own MyHumana account, you simply go to humana.com and then enter your Humana ID number, date of birth, and zip code. You will then be asked to create a username and a password. Your MyHumana account will give you access to view your claims, detailed benefit information, and find providers. Also available through your MyHumana account is a section called My Health. Within My Health, you stay on track with your screenings for things like diabetes, colon cancer, and breast cancer. My Health also offers online support to help you manage things like sleep health and COPD. And just a reminder to everyone, Humana has a dedicated customer care team. They are available to you Monday through Friday from 8 a.m. to 9 p.m. Eastern Time. Our customer care team can assist with any questions you may have about your plan, prescriptions, providers, and claim information. Remember, you can also utilize MyHumana or the MyHumana app. So we appreciate you taking the time to listen to this presentation. I do hope it was helpful.